Hello everyone, I'm Dr. Jisha Pillai, consultant dermatologist and cosmetologist at Lilavati Hospital, Mumbai. And I'm here to shed some light on psoriasis and its management. So what is psoriasis? Psoriasis is a common, chronic or long-term inflammatory condition of the skin but can also affect many other organ systems. Now it has been estimated that about 3% of the entire world's population have psoriasis. Psoriasis very typically presents with red, raised, itchy skin lesions with an overlying thick white, silvery white scales. They could be present on the knees, on the elbows, on the trunk or the scalp. They could even be present on the palms and soles, which may be in the form of dry, cracked skin. Now, what's so unique about psoriasis? Psoriasis, as mentioned, is a chronic or long-term disease that is marked with remissions and exacerbations. While the best of its characteristic features may be on the skin, about 40% of the people with psoriasis may develop psoriatic arthritis. So what are the causes of psoriasis and why does psoriasis happen? So psoriasis occurs because of an hyperactive immune-mediated system that makes the skin cells to multiply way too quickly. There could be certain triggers like certain infections like streptococcal or throat infections, certain medications given for other illnesses, weather conditions like extremely dry or cold weather, injury or trauma to the skin in the form of severe cuts, severe burns, habits including smoking and alcohol consumption. There could be many chronic or comorbid conditions that could be associated with psoriasis. So people who develop psoriasis could be at an increased risk of developing heart diseases, coronary artery diseases, hypertension, strokes, psoriatic arthritis, inflammatory bowel diseases. They could also be at an increased risk of developing certain psychiatric conditions like depression and anxiety. Now, how do we manage psoriasis? So there are varying treatment options when it comes to psoriasis. In case of mild psoriasis, we try to stay conservative in the form of topical applications like creams, ointments or lotions. In case of psoriasis of the scalp, we may stick to certain solutions or shampoos for the scalp. The mainstay of treatment here is topical steroids as it helps to bring the inflammation down very quickly. Certain non-steroidal applications include topical vitamin D analogs, topical calcineurin inhibitors, and so on. In case of moderate to severe psoriasis, it's important to understand that the more body surface area that is involved, it is harder to apply the topical solutions. Also, we believe that in case of moderate to severe psoriasis, this is more than just a skin rash. Also, we believe that in this case, this is more than just a skin rash because there's a high level of systemic inflammation that is happening over here. The newer molecules in terms of moderate psoriasis include certain biologics which have largely changed the era of psoriasis. So, what do you do if you or your family members are suspected to have psoriasis? It's important to seek medical attention from a qualified dermatologist at the earliest so that your treatment is initiated and you begin control over the psoriasis. Remember, psoriasis may be tough, but you are tougher. I hope this video helped gain insight into psoriasis and its management. Thank you.